So there has been a lot of questions about Ritalin or methylphenidate and dopamine. So I wanted to talk about this. I know it's not directly related to LDN, but since there are so many questions about dopamine, and there is some relevance to LDN through the connection with endorphins. So I think I'm going to do a video on this. So Ritalin or methylphenidate is one of the most widely used medications for ADHD or attention deficit hyperactivity disorder, and it's for improving focus and reducing hyperactivity. And how it seems to work is modulation of dopamine and norepinephrine. Dopamine and norepinephrine is are neurotransmitters, and there's other ones as well as serotonin, and I do believe that endorphins play a role as well. So dopamine, we know that plays a role in attention, motivation, impulse control, reward processing, and research shows that individuals with ADHD often have dysregulated dopamine activity, especially in the brain regions responsible for executive functioning. And Ritalin is supposed to help to correct that imbalance. So, number one, ADHD is not lack of dopamine. So the lack of dopamine, the absolute lack of it, or lack of dopamine, where we give people dopamine to treat it, is called Parkinson's disease. So it's important to know that Ritalin is not due to lack of dopamine. Rather, it has to do with dysregulation. So Ritalin increases the amount of dopamine that's available by blocking reuptake. So that's like recycling. The molecules, including neurotransmitters, get recycled by um, reuptake mechanism, and then if Ritalin blocks that recycling mechanism of the dopamine, then dopamine has to be around. And it sounds like a great idea, but in the long run, the body will overcome this by creating more receptors to facilitate the reuptake. And this is an example where body is incredibly complex in terms of homeostasis or trying to remain in balance. So in addition to blocking the dopamine reuptake, there's also increasing of dopamine release, and this is something that I think our viewers are very interested in, things that increase dopamine, and it by increasing dopamine and norepinephrine, Ritalin can strengthen the connections between neurons or involved in planning, attention, and impulse control. And so then the people with ADHD, this leads to better focus, reduced impulsivity, and improved emotional regulation. Unfortunately, it is an immediate for release. Formulations only give effect. It works right away, probably as soon as 20 minutes, but would only probably last. Textbook says 3 to 6, but I would say about 3 hours. And then for longer acting versions in the US, we call them Concerta. They say about 12 hours, but maybe about 4 to 6 hours. Um, it's I think that there are many potential side effects with this, which is insomnia, reduced appetite, and the one that I see a lot is anxiety, um, increased heart rate, and increased blood pressure. So I know that one of the reasons why people are interested in dopamine release is, I think, in an attempt to optimally function with their ADHD. And so the other videos will talk about other dimensions of neurotransmitters, including neurotransmitters like um, norepin, serotonin, and endorphin. And I know endorphin is not technically a neurotransmitter, but I think because of the low dose naltrexone connection, we should talk about that as well. Well, thank you. And if you've learned anything, please give me a like and consider subscribing. Thank you.